Hello friends, today I'm going to discuss about what is electrocardiogram and its applications. An electrocardiogram, that is ECG or EKG, is a test that checks how your heart is functioning by measuring the electrical activity of the heart. With each heartbeat, an electrical impulse or wave travels through your heart. This wave causes the muscle to squeeze and pump blood from the heart. An ECG measures and records the electrical activity that passes through the heart. A cardiologist determines if the electrical activity is normal or irregular. Now next, why is ECG done? ECG is done mainly to detect abnormal rhythms caused due to formation of blood clots, detect heart problems including a recent or ongoing heart attack, abnormal heart rhythms, other arrhythmias, coronary artery blockage, areas of damaged heart muscle from a prior attack, enlargement of the heart, and inflammation of the sac surrounding the heart, pericarditis. To detect non-heart conditions such as electrolyte imbalances and lung diseases, monitor recovery from a heart attack, progression of heart disease, or the effectiveness of certain heart conditions or a pacemaker. To rule out hidden heart diseases in patients about to undergo surgery. Now next comes is how what preparations are taken. There are no restrictions regarding food to eat or drink before an ECG. You'll have to remove your jewelry and wear a gown. An ECG is a non-invasive procedure. A number of electrodes, usually a total of 12 to 15, are attached to various locations on your body, including arm, leg, and chest. The electrodes are attached by small suction cups or adhesive patches. Sensors in the pad detect the electrical activity of your heart. The patient is laid on the bed in a still position when the test is performed. Results are most often recorded on a graph paper and read and interpreted by a cardiologist or a technician. The test is completed within 10 minutes. Next is how does ECG work? Each heartbeat is triggered by an electrical impulse normally generated from a special cells in the upper right chamber of your heart, that is the pacemaker cells. An electrocardiogram records the timing and strength of these signals as they travel through the heart. An electrocardiogram is also called a 12-lead EKG or 12-lead ECG because it gathers information from 12 different areas of the heart. These views are created by electrodes, typically 10 placed on the skin of your chest and sometimes your limbs. The electrical activity is recorded as waves on the graph with different patterns corresponding to each electrical phase of your heartbeat. A standard ECG can record an abnormal heart rhythm only if it happens during the test. Subabnormal heart rhythms come and go, so cardiologist recommends to undergo a different type of heart rhythm monitoring such as with Holter monitor to help diagnose the cause of your symptoms. Next, coming to the results. Your cardiologist will look for a consistent even heart rhythm and a heart rate between 50 and 100 beats a minute. Having a faster, slower, or irregular heartbeats provides clues of the patient's health, including heart rate. Normally, heart rate can be measured checking the pulse. An ECG may be helpful if your pulse is difficult to feel or too fast or too irregular to count accurately. An ECG can help cardiologists identify an unusually fast heart rate, that is tachycardia, or an unusually slow heart rate, that is bradycardia. Heart rhythm. An ECG can show heart rhythm irregularities, that is arrhythmias. These conditions may occur when any part of the heart's electrical system malfunctions. In other cases, medications such as beta blockers, cocaine, amphetamines, and over-the-counter cold and allergy drugs can trigger arrhythmias. Next, heart attack. An ECG can show evidence of a previous heart attack or one that is in progress. The patterns on the ECG may indicate which part of your heart has been damaged as well as the extent of the damage. Inadequate blood and oxygen supply to the heart. An ECG done while you have symptoms can help cardiologists determine whether the chest pain is caused by reduced blood flow to the heart muscles such as chest pain of unstable angina. Next is structural abnormalities. An ECG can provide clues about enlargement of the chambers or walls of the heart defects, and other health problems. That is all about ECG. If you have any doubts or queries, I request you to write the below mentioned comment box and I'll make separate videos clearing your doubts. If you like this video, kindly click on the like button and subscribe to this channel. Thank you. Have a nice day. Bye.